Mental health illness at workplaces has increased over the years, with close to a third of workers said to be experiencing mental health breakdown. Now, mental health experts and partners are calling upon employers in all settings to create a conducive environment for their employers to avert the alarming situation.
Studies showing rates in the legal profession and in the teaching profession, these rates are very, very high. In some studies, they show up to 60% of workers having mental health problems. So it is a problem that we need to attend to, because many people are in the workplace, many of the adult population. And the workplace does not mean office necessarily. It means anywhere where you do your work.
And if we just look at the just concluded census report, although the results are continuing to be analyzed, but they pointed out that about 20% of people have severe psychological distress. And in this, it's just showing that many people are reaching the end of the road. They are not seeing a future ahead of them. That's what it means, severe distress. That's what happens. Someone loses hope. Someone is just so confused. They cannot take any decisions. They cannot do anything because there's a missing link. There's something that is missing in their lives. It's not connecting very well. And this is just, that number was just so much because initially the numbers were very low for people who had severe psychological distress. But we're also seeing quite a number of people. We have heard from our reports here that there's quite a lot of depression within communities. 28% of our people are having depression, which requires to be supported.
The Ministry of Health and partners commemorated the National Mental Health Day held at UBC grounds. The day is an opportunity to talk about mental health and show that it matters. It is also a chance to break the stigma surrounding mental health.
As government, I think what we need now to do is to be more proactive on mental health issues. I'm well aware that there are health and wellness programs which are ongoing, and this is more of a cross-cutting issue that should now be brought on board so that for purposes of affirmative action, it is well articulated to all staff.
We always encourage workers to associate freely, associate with your fellow friends freely. Tell your manager, tell your human resource manager your problem, so that maybe it can be looked into. Because stress is caused by what happens to us. Most especially at workplace, people have loans, have financial obligations. They have gotten loans, they have gotten challenges, sickness, but it ends up becoming a stress because you are not clearing the loan. So sometimes when you tell somebody, the issue is always tell a friend.
Experts say that there are many things that can trigger mental health illness at workplace. On their part, employers have been advised to do the following to address mental health challenges at workplaces.
So there can be also environmental problems within the workplace. For example, work settings that have a lot of noise. So stressful work environments that are very hot or are very noisy or are very dusty, like factories, those can be problems for the worker. The system itself or the culture within the workplace can be a problem, can trigger or can be, can underlie mental health challenges for its workers. If a workplace has a culture that does not support mental health and well-being, and the management is not one that understands mental well-being or does anything deliberately about it, challenges will happen.
Zahra Abigaba, UBC News.